pawb, croeso gynnes iawn i'r bwrdd Agored heddiw. In terms of people here today, I'd like to welcome Dawn Bratcher, Assistant Director of Strategic Partnership Engagement and Insight, and she's here to observe the meeting. And Martin, where are you, Martin? There, I saw you. Martin's here. He's our Deputy Director of Education, Commissioning and Quality, and he's here in place of Ian Matheson, who is on holiday. The other absence we have is David Bebb, who's also on holiday. Are there any interests to be declared that are not already declared that are pertinent to today's meeting? Okay, thank you. You have the draft minutes of the board meeting held on the 31st of July. Can I confirm that you've all read them? Are there any matters of accuracy that you wish to raise? Can I ask you to go to the action log from the board meeting held on the 31st of July? Is there anything you wish to raise about the action log? Lisa?
I can just actually now report to you that action 310, 3107 4.4, Welsh Language Annual Report. At the time the papers going out to chair, I wasn't being able to complete it. It has now been completed.
Okay. Do the board members need to see it?
I think you've been circulated to the information, and then that's been incorporated into the report, which will be published.
So it'll be on our website?
Yes.
Okay, all right. So are you happy with the action log? Thank you. Can I take you back to the minutes? I'm now asking for any matters arising that are not covered by the action log on today's agenda. Are there any? Can I ask therefore that you approve the board minutes and happy for me to sign them?
Yes.
Okay. Thank you very much. Chair's report today is very brief. We're in a really interesting period coming out of summer, looking forward to the autumn, and what a tremendous summer we've had. The organisation has been very busy. Our major focus has been on the education and training plan, which is a really important piece of work. And today's meeting is focused on moving to approve the education and training plan for submission to Welsh Government and the Cabinet Secretary's consideration. This is an annual cyclical piece of work. It is mega complex and has, I would say, never been more complex than at this point. And there are many, many factors which we will have explored. We'll talk about in a minute. The Director General is changing. We have a new Director General starting in October, and there are a series of changes amongst the leadership of the health boards, people coming to the end of their terms, and those processes are ongoing. So this is a moment of great change, and of course we are entering a period, a pre-election period, over the next 6 months, looking at next May. So there's some big plinth issues in and around this. So with that, I'm going to hand over to Alex, who's going to lead on this.
Yep.
And this is the Education and Training Plan 26-27. And that's the other thing to point out. This is forward-looking. This is not this year. This will affect from September 26 going on to 27. Alex.
Thank you, Chair. I'm just going to do some introduction really to the plan, and then I'll hand over to Glyn for some of the financial information, and also bring Tom in, because I think graduate medical education part of the plan is really important this year. But obviously the rest of the team are available for questions as well. So the board has received a number of updates on this plan as it's been developing over recent months, and so this is the final draft for final comments and hopefully approval prior to submitting to Welsh Government. The ETP, as we all know, is an important vehicle to agree the future number of education and training places for NHS Wales, as the Chairman has just described, looking forward to next year, and the associated funding with those places. And we do that on an annual basis to inform the contracts we hold with our higher education partners, but also the UK recruitment processes that are critical to our postgraduate programmes, as well as the allocations that we hold within the education and training plan. So for us, this is just as important as our INTP, because it secures around 85% of the funding that we have as an organisation. So it is a really important plan. Since HEIW has been established, the education and training plan mechanism has actually secured increased investment in the future workforce pipeline. And if we go back to 2019, 2020, we were actually spending around £206 million on education and training then. And in the current year that we're in, we're likely to spend around 320 million. So you can see how this has been a really, really important mechanism to strengthen and expand education and training programmes across all professions, but also supported by more geographically based and more flexible provision as far as possible. In fact, we were just looking back at the nursing sort of profile over recent years, and if you go back to 2021, actually we were only starting in training around 12 to 1300 at that point, and obviously recent years we've seen over 2000 being trained. So that's a really good indication of the way in which the education and training plan has really supported the development of much healthier pipelines for our future workforce. It's also helped us shape the HEI market in terms of availability of programmes in Wales. And as I said, it provides a really important way for us to really nail the numbers that we need to put into the UK recruitment processes for medical, dental and pharmacy programmes. And that's really important because obviously we are competing across the UK to get the best possible people into NHS Wales. In the main, the ETP investment has secured a really positive transition from education into employment. We're much better informed about that now, thanks to the better data that we have. We wouldn't have been able to tell that 5 years ago, but now we can tell what is happening to those people that we're training, where are they going in terms of the workforce, and therefore we are able to assess really the impact of that investment, not just that it's been a cost, but it's been a benefit in terms of addressing deficits, shortages and vacancies that have affected patient care. And overall, that's really contributed to the growth of our workforce. In our workforce trends report, which we are about to publish, you can see that actually our overall NHS workforce has grown from around just over 80,000 in March 2019 to just over, or nearly actually 97,000 in March 2025. So, you know, the increases that we've seen coming through the education and training plan are undoubtedly part of that, you know, really significant increase in the overall NHS workforce. This year, as the Chairman said, it's a bit complicated, and we've had some new considerations to take account of as we develop the ETP. And what we've seen is that better retention, and again, you know, we do play a really critical role in that All Wales retention programme, better international recruitment, and policies like retire and return are having a positive impact on some of the workforce demand that we've seen in previous years. And what we're seeing is that some of our vacancies are positively reducing, but that does impact then on the demand for graduates in particular in some of those areas. But that's overall a really positive story, isn't it? And I think this does demonstrate one of the fluctuations that we have seen since COVID as well, where COVID gave us a particular reaction in the workforce. Some stayed a bit longer than they would have after COVID. Some left more quickly than we would have liked. but things seem to be evening out now, and some of those other initiatives that have been put into place are having a really positive impact. Alongside this year we have really seen some of the current financial and service pressures, particularly on our health board colleagues, start to drive real changes in delivery. And this has resulted in some of the original workforce planning requirements that informed previous ETPs starting to change, because obviously the focus is on transforming within existing resources in the context of significant saving programmes and doing things differently. And I think when we look forward over the next 10 years, there is a lot more of that to come. And I think our sort of mantra as an organisation would very much be, we can't just recruit and retain our way out of this issue. We have to focus on transformation, and we are seeing that transformation start to take place. And that has resulted in some areas on more difficulties in actually employing some of the graduates we have been producing, because the demand has changed. And that has increased this year compared with previous years. So we are managing that very closely and working closely with employers to make sure that we do find roles for as many of those graduates as possible. But it is a signal to us that the system is starting to change. There's also a renewed energy and commitment this year towards an expanded and strengthened approach to primary and community services. And that is a very current and live discussion with the Cabinet Secretary. It was clear from the Improving Performance Together publication in June, and obviously goes to the heart of a healthier Wales. And we need to make sure that we maintain the good foundations we've put in place over recent years in relation to primary and community, which I feel we have always prioritised as an organisation, and really stands in good stead to deliver on those policy and strategic ambitions. We've also seen this year some constraints arising from HEIW pressures, such as the Cardiff University plans for nursing provision, which will give us an impact on capacity, particularly next year, but also arising from an analysis of the NSS student feedback scores, which show us that some programmes are having some difficulties in managing the numbers to the quality that we want, and so we need to bear that in mind as well. There are also some challenges in implementing some of our newer roles. So we have seen some real issues affecting how we deploy our PAs over the last year. We've now had the LEN review, but that is not yet in clear and open water in terms of how we will take that forward. And we've also seen some obstacles in implementing our clinical associates in applied psychology, again, due particularly to funding reasons, whereby health boards are not able to take places on that scheme. And so we've had to give really careful thought to next year's approach to some of those programmes. And last but not least, the current financial context for NHS Wales is really, really clear. There are significant financial constraints this year. Those will continue into the next year. We've obviously got an election in the middle of all of that. And so we need to be really cognizant of that, both in terms of the investment we want to make in training, but also the money that's going to be available to employ those people in the next couple of years. And that comes back to our, can we recruit and retain our way out of this, or do we need to transform and really integrate workforce with the digital opportunities that we often talk about as well? So those are just some of the factors we've had to take account of in developing our ETP this year. So the approach that we are taking, and that you will hopefully see within the ETP, is that despite the fact that in some areas workforce demand appears to have lessened, it's really important we continue to take a balanced approach to the ETP, because we know that, and we have experienced in the past, how a feast or famine approach to education and training has really led to critical shortages that impact not just on patient care, but staff wellbeing, retention and cost. So we've got to be really, I think, measured and make sure that we are planning for the longer term and that stability that we want to see, rather than reacting to some of the issues that may have come through in this current year. So most of the plan is based on broadly maintaining the fill rate we have experienced last year. There are some areas with a modest increase, and there are some areas with a modest decrease. We are also, however, prioritising expansion in a few areas where there is a clear and recognised need. And this is particularly in relation to postgraduate medical education, which was really squeezed last year in the ETP, and where we find ourselves now on a bit of a back foot in terms of the plan to make Wales more self-sufficient and have an aligned pipeline right the way through from medical schools right the way through to specialty and GP training. We're also prioritising an area like ODPs, operating department practitioners, because they are really fundamental to our perioperative workforce, and clearly that is critical in terms of the MAG recommendations. We're also recommending maintaining the investment we've made in primary care and mental health, recognising that this has grown over recent years, but making sure that we're reviewing the use of this funding to ensure we're responding to new priorities. We're also recommending that we do pause some programmes to really give us a chance to make sure we've done all of the right workforce planning, taking account of things like the LEN review, to make sure that in reinstating those programmes going forward, that all of those issues are fully addressed. And ultimately, our approach is obviously to optimise our scarce NHS resources and investment. So hopefully in the plan, you will see the detail of those recommendations. I think some of the caveats before I hand over to Glyn to go through the finances associated with it are that, you know, we are still in this annual approach to our ETP. We all know we would like to be in an approach where that is informed by a longer term approach to workforce planning. Conversations are going on with Welsh Government about how we get to that point, but we've got to be realistic in the here and now. It is still informed by Health Board IMTPs, what we understand about the very immediate future, and so it is still, I would say, quite a short-term approach to this, which again we need to just bear in mind. I think the other caveat to the plan is that in an ideal world we probably would shift a little bit more in favour of some of the priority areas. We probably would put more investment into primary and community, and I think we would probably allocate more investment to support some of the MAG priorities. But at this point in time, I think we've got to be really prudent. We've been told by Welsh Government we have to really work on the basis that we're not having any additional funding for the education and training plan. And so I think we really have to prioritise, even at this point, what we think is essential versus what we think would be ideal in an ideal world. Because really what we want is for this plan to get approved as soon as possible, so that there's no risk to our recruitment processes this year, and that we can get on with implementing what is still, I think, a really good position. But you know, we're not living in an ideal world, but I just wanted to flag that because I think there is probably more we could have done with more investment, but that's not the situation that any of us are in the NHS at the moment. So I'm just going to hand over to Glyn to give an update on where we're sitting from a financial perspective, and then I'll ask Tom to just comment a little bit more on the medical part.
Okay, thanks Alex. And I suppose just taking everything that Alex has talked through, the plan comes up with a set of recommendations. So those are our recommendations, our professional view about what we should do in terms of commissioning education and training. The financial plan reflects the investment that we would require to deliver all of that. And what you'll see at a very high level is this year, the plan has a value of about £320 million. If we were to deliver all of the recommendations that we've put in the plan, we need an investment of an additional sort of £23.6 million, so about 343 million, moving up from 320 this year. And I suppose the important thing to say here is some of those additional costs don't necessarily buy us more education training places. Some of it is to do with policy decisions around tuition fee increases, around the change in the bursary and student loan policy as well, which obviously helps in terms of improving the financial sustainability for the HEI sector, and also hopefully encourages more students to take up some of the places, the health education places. But essentially it's a cost that enables us to do that rather than buy more education and training places within the plan. So you'll see within the increase in investment that we're looking for, there's almost £4 million that would relate to that. What we've also included and identified in the plan is another sort of policy change by UK government around increasing employers' national insurance contributions. And you'll be aware that this year HEIW, along with other NHS bodies, is having to manage a shortfall in the funding and the cost of national insurance contributions. Now that continues and increases slightly as we go through to next year. So again, we've reflected that in the financial plan in terms of delivering the recommendations. The third section, which I guess is really important just to understand, is as Alex has sort of already described, over the years we've been increasing the number of places, education training places, and what that does is it effectively has a compound effect financially then, in that if you're increasing the number of training places and those students are progressing through years 1, 2 and 3, the pipeline will increase. It's exactly what we want to achieve as part of our workforce objective. But it will inevitably mean that in terms of supporting those increases in students and trainees in the pipeline, there is naturally going to be an increase in costs to deliver that education and training. And that's around about £7 million. So when you add all of those things together, around about £12 million of the 23-24 million increase that we're looking for is related to things that are already effectively in existence or are unavoidable in terms of delivering the plan. And I think that's quite an important message to understand in terms of the overall investment that we're looking for. And then approximately half of the other half of the 23-24 million is related to those areas of priority that Alex has just outlined. So you'll see in the plan that there are increases that we will be looking for in investment around increasing foundation places for doctors, specialty training, and also GP training posts. So when you combine those, that's around about £8.5 million in total that we would be looking for new investment to increase in those training places. But obviously those are key to delivering some of our workforce and service priorities across the NHS. There are also areas that we've identified where, again, we believe it's a priority to increase investment. So you'll see that with pharmacy, for instance, another area where we'd be looking to increase the investment around foundation programme places, but also we fund the placements for pharmacy undergraduate students. And there are an increasing number of pharmacy students in Wales, particularly with the expansion of the school in Bangor as well. There are more modest investments in around dental and optometry. But again, what you'll see is going back to that key message about investing in primary and community services. This is one of the areas where we're focusing some of that new investment that we're recommending in the plan. In previous years, we've tried to model a number of different scenarios just to try and help progress the plan. I think, as Alex has said before, this has been particularly complex this year. And when we started to look at how the recommendations were shaping up, we felt that it was probably useful to have one alternative scenario, but probably not to complicate things by trying to create too many different scenarios. The alternative scenario that we costed up, really just to give a comparator, was to really say if we just commission the minimum contract levels for particularly our undergraduate education and we maintain training numbers, how much would it cost just to do that? And that would cost an additional almost 17 million just to achieve that scenario. So you can see that there is that inbuilt investment required just to carry on delivering and maintaining a lot of the pipeline that we've got at the moment. So I hope that's helpful. Obviously, the plan sets out some of the risks and opportunities that we have in delivering what is a very complicated and quite diverse plan. But happy to pause. Hand over to Tom if Tom, you want to add anything further.
Thank you very much. Yes, I think in terms that Alex and Jim have covered many of the points around postgraduate medical training, and although, as Alex said, this is an annual process, the education and training plan, it's not possible to do that without a more forward-looking approach for the postgraduate medical pipeline because of the length of that training process from when people go to med school for 5 years, and then between 5 to 10 or 11 years is the pathway before then either become GPs or consultants. It's not the only route, of course. Not everybody has to go through training pathways, and we don't want everybody to be consultants. It's and part of our agenda in that transformation space is supporting the flexibility of people to go down other routes and be locally employed doctors. However, we do need the ambition for us to be more domestically self-sufficient, recognising the global nature of medicine and other healthcare professionals and supporting that because it's good. We do need to be as domestically self-sufficient as we can in our supply, and those ambitions started some years ago with the proposal to open the North Wales Medical School, which is now open. And we were involved as an organisation in informing a lot of that work with the ambitions to develop the medical student number output within Wales to circa 600 by 2030. And the recognition that really keeping an eye on the rest of that medical pipeline over that period was going to be really important if those ambitions were to be fulfilled. So, as Alice commented last year, with the difficult financial context, there was a pause perhaps in the sort of plans that were in place for the numbers, with a relatively small increase that was done. And what these recommendations that are here in relation to medicine now maintain that alignment. We have got ourselves into a very healthy position in terms of our pipeline alignment in Wales, thanks to the ETP implementation over the last several years and that investment. But it is important that that continues quite quickly destabilised. And I think it's also important to remember that whilst we're looking at the future with this pipeline, it's also the now. These people are qualified doctors and are providing service from day one that they come in. If they're not there, the health boards will be funding locums and trying to pull in people at additional costs. And that applies also to GP trainees who from day one are delivering about 75% of the activity of a GP within those GP settings and supporting that pressure that we have in relation to service demand out in the communities. They also do a year in GP training in secondary care, and a fundamental part of sustaining those rotas. If we drop our numbers, those gaps still exist, and the money in the system still has to support maintaining that. So actually not investing in these posts, that money is still going to be there and be used in the system, probably with less effective output again. So these recommendations maintain that phased increase in foundation. As a nation, we have to be committed to matching our foundation F1 posts to our medical school outputs, as the other nations across the UK are, because just do not reach full registration until they've done 1 year in foundation. So without the opportunity to do that, they do not even get to the point of full registration. So we have a responsibility collectively. Even though we recognise there will be movement across the nations, each nation needs to ensure that they align their foundation posts. And that is where that recommendation comes from. Expanding the GP posts disproportionately to the secondary care, there's a much greater uplift that we're putting there, and I've articulated the reasons for that. Our modelling to 2030 suggests we really do need an intake of 300 a year to achieve what the collective ambition is for a GP workforce that actually starts to shift that stagnation we've seen in whole-time equivalents across Wales. What this does is it starts to support that primary and community care agenda that we were talking about. We have increased the capacity to accommodate it. Secondary care posts align very much to those fragile services, the priorities we hear about nationally, stroke, vascular, mental health, there are opportunities that have been created through the previous education training plans, which we need to capitalise on. For example, we've referenced psychiatry. If we do not establish those higher psychiatry posts at this point in time, when all that hard work we've done to increase the throughput at the core level, it simply means we won't retain people for the next phase of their training. So hopefully that explains the sort of breadth and the context behind the medical recommendations and why we do feel we need to prioritise those in this difficult context we all find ourselves.
Hey, Tom. Before I open it up, I just need to make sure for people listening in or reading the minutes of this meeting that actually the board members have been closely involved throughout the development of this plan. And I also need to underline that the amount of work that the organisation has done with partner organisations and with colleagues to gain a view and to look at the IMTPs of the health boards and their futuring and their service modelling is another tier of complexity which needs to be done. I'm very grateful for the way the partners have worked with us. This plan that's here today is not strange to the board member, to the independent members. So I'm going to open up for questions or comments, please. Dawn?
Yeah, no, I think the ETP was technically strong. I suppose my reflection is not that the content is missing, it's the way in which we have an opportunity, I think, to set the story in a leadership voice. So maybe, you know, with any big document, the executive summary is probably the way to frame that, because it's a point of sort of capturing. You know, if I was able to record exactly what you were saying, Alex, that what came across as sort of the decision and the balances and telling that story and put it in that executive summary, I think anybody reading the document then would see themselves in the story. I feel as if that needs to be considered within a sort of a bit of a rewrite on the executive summary.
I obviously endorse the plan. I think it's a robust plan. I think it's reflective of the system, what's needed. And I'm pleased to see that previous iterations now, a current iteration now includes comments from board members. I particularly liked on this occasion the overview that was presented at the start and what was different, what's gone up, what's gone down. Those snap bullet points, I thought hit you, and I thought that again is reflective of comments that board members have made in the past, and I thought just sharper.
This is the first time I've gone through this process. I must admit, I'm very impressed about the process and engagement we've had with independent members in terms of how it's developed over time. The plan to me is coherent. It's modest, as Alex says. We'd like to do more, but recognising the situation we're in. But we also recognise we're probably going to get battered back on a few points, undoubtedly, because of the challenges that's there. In terms of the content, what I did like, very much like, was chapter 2, where you put the narrative in, but also the rationale, and that was really compelling. I thought that was more compelling than the executive summary in terms of it could sort of justify what was there and the logic behind it, because undoubtedly you'll get questions in from most of those bullet points. That's it in there. The final comment I have is on the financial plan in terms of Glyn's presentation of the existing policy commitments that are there and the commissioning that's already there are not really. There's a very modest additional investment proposal within.
Yeah, thanks. It's interesting. I agree with what Donna said, although I did think actually the executive summary did capture that there will be opportunity. Obviously, this has to go in with something to introduce it to government. So maybe that's the opportunity. I just think it's a really good document. This is my second one, but I wasn't quite up to speed enough to feel it last time. And I think one thing that struck me was who is going to read this, because there's some really, really important issues in here. And I know from experience of workforce planning, there's a group of people who just look at the tables at the end and the figures. And I suppose therefore my question is, how do we make sure that we can reinforce the dialogue that we will refer to in those conversations? I was particularly drawn to the section, page 18, I think, on the NHS Wales workforce context. And in there, there's a section on the population change, which demonstrates what HEIW can do, having looked at that and what's happened. There's a comment in the labour market intelligence talking about that this something needs consideration. And I suppose that led to my question, well, by whom? And is that a space we should move into or not? But really, that's just use those examples to illustrate my point that there's so much in here away from the numbers, and how we collectively really keep reinforcing that. I guess particularly the Welsh Government, but actually with partners who have all signed up to this, but making sure they really take on board some of the messages there. But I think it's excellent. Just a tiny minor point on the covering paper, it talks about Tom as the interim medical director. So just from a governance perspective, can you change that to say acting? Yes, but it says interim on the paper, so it's one or the other needs changing. Sorry.
Kelly, did you want to say something?
No, no, thank you.
Want to say anything, Jane?
As you say, Chair, we've had many opportunities to input into this, and I think the product is really, really good. As you know, my concern repeatedly is that we have an annual process, and I'm encouraged by what Alex said in her introduction, that there are discussions about how we can actually develop ETPs within a longer vision for the NHS workforce in Wales. And I think the points that Glyn made about the cumulative impacts of previous decisions that we have made, it simply underlines the fact that we need a longer term view. And this is simply should be a component in how we're delivering that longer term view of delivery of a workforce for this nation.
Similarly, I endorse this plan. It's like, as we've gone around the IMs, we're sort of saying we've seen one, we've seen two, we've seen three, and I think this is a really strong document. I think given the current situation, you know, it is very clear. I found the chapters, as Judith said, you know, provided all that appropriate context and set the scene. Undoubtedly, we know, like you said, people will read certain bits and look at particular lines. And although we've had lots of opportunities and our stakeholders have been involved along the way, there will be some people who are disappointed when they see this. But I think that the narrative and the explanation is really good and really strong.
Yeah.
And I agree with Judith about, you know, as always, this is the work that needs that longer term, not just this annual cycle. However, we've seen changes that have been quite rapid in terms of having to be flexible to change what we want to do. And I fully support the areas, and you know, it would be great to do more, but we have to be realistic what we can at this particular point. But again, and I would just commend all those that have been involved in this, which have been an exceedingly, you know, a difficult piece of work, and yes, and thanks to all those that have got us to here today.
So I've got just a couple of observations before I ask us to group. First observation is that this is one of the things you can never be satisfied with. It is an annual thing, and there's so many iterations you can go through. You can get blinded, snow blinded. The complexity has been touched on, and the amount of complexity that's been explained is understandable. But there are many, many more aspects to the complexity that you can't put down to other than the experience and the professionalism of what this organisation does. And I suddenly realised, Alan, I asked you as an independent member to look at value for money and what is this organisation's impact. If you ever wanted to read what impact HEIW has on the system, this document is an evidence base rich in achievement. And the best bit of achievement is that you get so far, but you're still not satisfied. And we're changing it. So I think this this annual approach is not the best approach, but it's not half bad for being able to make you really reflect very quickly and give the opportunity to inch change rather than go for drama. I think that your introduction today clearly wipes the frost off the window for people who aren't like us. You know, we're a bit like geeks, aren't we? You know, we will have read, I will guarantee most of you have read every page and looked at every table. God knows what the exec team have done. And God knows, Martin, what your department's been doing, right? The amount of work, the productivity in the NHS to develop good professionals, that isn't understated. We are very good at producing healthcare professionals. We are very fortunate to have the backup of the universities and their courses. And we mentioned quality. The big focus for me in the future is the balance of this ETP. We'll have to look more at the postgraduate education and training to enable the velocity and direction of the change that will be necessary. That's been driven by health board plans and by the government policies in the future. So I think that for what its purpose is, from my point of view, I read this as something that has in a phase of maturity. And my God, has it benefited from the data and the informatics. So this brings me to my final point. I think that if someone tries to salami slice this, they'll inevitably end up like a chip shop. It'll be all over the place. This is a package, and it's a thoughtful package, and it absolutely reads across the Cabinet Secretary's priorities as they stand. So I'm asking you to approve the education and training plan, including the commissioning recommendations set out in the report. Yeah?
Yes.
And I'm asking you to endorse submission of the plan to Welsh Government as HEIW's professional advice on the workforce, on future workforce commissioning.
Yes.
I'd like to add in that I think there should be what you have verbalised this morning as a cover in this, so that I think we need to have a plan for communication to our partners. And I think I gave a verbal report to the chairs of health boards and trusts yesterday. I think we really need to have a narrative going forward that we can all of us use in our various places that we have where we meet externally and with the professional bodies. Everybody will have a look at what's in it for them. Actually, there's more to this. It's about what's in it for the patients and the NHS. And I'd like to see in that summary something what this does for patients. So, you know, what we've got here, I think, is a very solid position. I think the communication bit we should have as an action from today.
I think that's a good point. So I think going back to, I think Donna mentioned about stakeholders will look at it and look at their particular part and see that maybe it's not what they would have wished for. And although the stakeholder reference group has been involved along the way, the plan is really, I suppose, only came to conclusion over the last month. So the conclusions are very familiar to the conversation I had with the chief execs, the NHS leadership board, but probably have developed since we've had those earlier conversations. So I know it is slightly unusual because it's not an agreed plan. It's only agreed from our perspective, isn't it? It needs the Cabinet Secretary to approve it. But I do think in this instance, it would be good for you to write to the stakeholder group with a copy of this plan that we're submitting to make some of those points, but also to avoid any criticism, I suppose, of being less than transparent about the fact that this process has evolved and maybe we've come to a conclusion in the last week. So I think to do that would be good. But I think in terms of all the other groups, I think we just need to just bear in mind this is not an agreed plan at this point.
Yes.
And that's obviously the Cabinet Secretary to.
But I think it's also useful for people to have the reflection that whilst this has been complex, it has been properly thought through. That the number of hours you have spent with this going around and around and around, and then the nuances aggregating as you find more, because every time you turn one of these pebbles over, there's some more, right? The ramifications, the ripple effect on across the board. So and then the moving state of the complexity, the financial position in the NHS across the UK has escalated. The issues haven't gone away. The demand for performance hasn't gone away. Mrs. Jones and Di Bach's needs are still there. And having a stable workforce that can be developed, and I think that's a key change. It's not just having a qualified, highly trained workforce. It's a highly qualified, trained workforce that is able to develop. And I think all the reports that you read, national reports, are in signalling that. And finally, actually supporting what we all believe in is a primary and community base, which is much stronger than it is now. I think that those are really wholesome messages, but they have created real issues of choice. I think people need to understand this isn't just a back of a fag packet issue. This has really been done in a very thoughtful and meaningful way. So the recommendation is that this goes through to the Minister. And yes, I would really like to write to partners, and I'd like us to have in all our outlets be able to take this to the near meetings to explain what's gone in and why. And I think that might help us also help the Cabinet Secretary in coming to decisions. Is everybody okay with that?
Yes.
Finally, I'd like to thank everybody who's been involved. And Martin, you can take this back to the team, right? And, Tom, this is a shedful, right? This is a real shedful, and it is important to get as right as it can be at this moment in time. And Sian, the informatics bit of this, as you can see, and your people within the organisation need to understand that their little windows in what they do in a highly professional way really have big impact. And this gets it to a position where the Cabinet Secretary has got something to really go for. Okay. I've put on the agenda the corporate risk register. And I think it is really an important thing that every board meeting we consider this and give certainly you as the chief exec and the executive team the opportunity to have any reflection following today's decision to submit this. Does the corporate risk register, does it reflect the risk as it stands? Are there any views on that? John?
Thank you, Chair. And I do appreciate it's been on the agenda. I think it's important that we keep a focus on our key risks. I just would ask us to perhaps reflect on some of the risks as to whether they are reflective of positions that have changed within the last few days. So that's the point. I think it would be useful for board to have a current position with regards to risk 4, and that is around initial intelligence around recruitment and early clearing. For some of our programmes, the narrative currently is stating that it's very variable across Wales. So I think it would be useful for us to know where we are and what that sort of trajectory is looking like. The second point, if I may, Chair, is around risk 11. And I think that perhaps needs to be reflective of the Minister's statement with regards to the physician's associate. And in light of that, whether that risk is still static or not, or whether that is changing, appreciating that it's read. And I ask the question just for us to reflect on whether we're accurate in our register. And the last one is risk 15. And it's positive to read so that the colleagues have made significant progress with regards to nursing provision and the dialogue with Cardiff University and other providers. And again, I just ask the question, with that positive trajectory, are we still in the position of it being read and static?
So can I suggest we give the exec team the opportunity to reflect on those questions, and perhaps you could feed back to us between board meetings?
Yeah, okay.
Yeah?
We can respond to them if you want, but...
Do you want, well, given that this is an open board meeting, I think it'd be better if we did it that way. Okay.
Yeah, I have a comment on risk 18, which is the new one. It's really in the table, the description which talks about reputational damage. I would expect to be some reference to health boards in there, not necessarily in the reputational damage, but it looks to me, reading this, as if the risk only sits with us and the HEIs, when in fact the risk also sits, or the reputational risk sits with trusts and trusts, employers. So I wondered if that could be included in the review as well.
Yeah.
Things.
Any other commentary on it? Okay. So Alex, perhaps at the next executive team meeting, you can just reflect on those, and we can get a proper positioning. I've got no other urgent business on here, so diolch yn fawr. I'll close the open board meeting. Thank you.
Thank you.